Hello, my name is Brianna Carlson, and I am a registered nurse in the emergency room here in southern Idaho. I have been a nurse I graduated in 2018. I did take a year off to complete my bachelor's degree, and then I began working in December 2019 in the emergency room in San Bernardino, California. I worked in the emergency room in Southern California for almost a year and a half, right when COVID hit. Shortly after starting on the floor, we began to hear the news about the virus COVID. So that was a interesting introduction to nursing. I moved to Idaho roughly a year and a half into nursing. I worked in the urgent care for a year and then transferred back into the emergency room here in the Magic Valley. Let's see, what made me want to become a nurse? It's actually a very long-winded answer, but to shorten it up, my dad had a heart attack when I was 10 years old, and I just wanted to know what to do if it were to happen again. I had an uncle that was a fire chief, and he kind of talked to me about emergency medical services and just gave me a good foundation on what that was. So after that, I decided I wanted to be a firefighter paramedic. I was a fire explorer throughout high school, and in my junior year, I took an anatomy and physiology class, and a nurse came and spoke. And from then on, it kind of put it on my heart that I wanted to get into nursing. So after high school, I began taking the prerequisites for a nursing program. I wanted to get into the medical field, so I also got my EMT. I began working in EMS. I was there for roughly 8 years as a EMT basic and then a EMT paramedic. I worked in Southern California, anywhere from San Bernardino to Barstow to Joshua Tree, 29 Palms. It was really nice because I worked both in the city and very rural EMS, which was interesting. After a number of years doing that, I decided that I did want to go to nursing school, so I began taking my prereqs again for the nursing program. It was a very long process, but my advice is take one class at a time and you'll get there, just one foot in front of the other. Like I said, I graduated in 2018. I started working in December in 2019 in the emergency room. And talking a little bit about what we see in the emergency room, our patients range from 1 day old to 100+ year olds. There's just a wide variety. We see every single age, from pediatrics to geriatrics. And the patients we see can vary from a cough or stub toe to a patient that's in cardiac arrest. And that can change at any moment, which is kind of exciting because you never know what's going to come through that door. And talking about my average day as a nurse, I work mid-shift. So I work either 10 a.m. to 10:30 p.m. or noon to midnight 30. So when I come in, I am either opening up a pod of patients, as it's referred to at my hospital, or I'm getting a report from a nurse. So when I come in and I check in, I meet with a charge nurse and I get my assignment. So like I said, I can be opening a pod or working as a float. In my emergency department, a ER nurse responds to every rapid response or code on the floor. So when we do respond to a code on the floor, we are the ones there pushing medications, and those medications could be to intubate a patient or to try and get their heart going back again if they are in cardiac arrest. So let's see, I get my assignment from the charge nurse. If I'm getting a report from a nurse, I will go speak with a nurse, get report on each patient. And while I'm doing that, I'm kind of looking through their chart at why they're here, what prior medical problems do they have they been seen before for this, what was the result of that, and kind of get a picture of what's going on with my patient. I'm also going to see them based on their severity, and that being the most severe patient I'm going to see first, or the sickest patient I'm going to see first. So after I've gotten a report from the nurse and I've kind of looked over their chart, I go and see my patients. And I introduce myself, let them know that I'm going to be their nurse today, and kind of gather an assessment on them. In the ER, we do focus assessments, but with that, I'm also trying to gather information about like the patient's neuro status. Are they with us? Do they know where they're at? What's going on? What year it is? Do they know what happened to them? Maybe it's a trauma patient. I'm trying to find out what happened to them. So I'm trying to assess them and gather bits of information on why they're here. I look at it as kind of a puzzle that we're trying to put together. So I'm assessing patients. One of the things that we assess on every patient is neurological status, cardiac status, and respiratory status. Every single patient that comes in is going to be assessed for those things on top of what their chief complaint is. And that chief complaint can vary from a patient having stroke symptoms to a patient having chest pain, to maybe a patient that's in respiratory distress. But we are doing all those assessments on that patient along with more of a focus assessment. So if they're here for respiratory distress, I want to listen to their lungs, look how they're breathing. Are they breathing fast? Are they breathing slow? Do I hear any audible noises? Are there wheezes? And what medical history they have that can be facilitating or, for lack of a better word, aggravating that issue. So once I've formed my assessment and kind of look at the plan of care from the provider, I'm going to be giving medications based on why they're there. If they are a cardiac patient, I may be giving aspirin, nitroglycerin, morphine, just medications that are going to help open up the vessels within the heart and kind of decrease their pain and help with platelet aggregation. So being an ER nurse, like I said, you're a jack of all trades but master of none, but you are you know a little bit about everything. One thing that I'm very knowledgeable about and passionate about is cardiac patients. I love the heart. It's my favorite thing. So I want to know why I'm giving those medications. Well, why am I giving that aspirin to this patient having chest pain? Why am I giving this nitroglycerin to this patient with chest pain? Well, the aspirin is going to prevent platelet aggregation, so it's going to further prevent that clot, or the nitroglycerin that's going to help open up their vessels. So you have to have a good foundation of knowledge on just about everything. In my emergency room, we are so blessed to have a pharmacist there that is able to answer any questions that I have regarding medications, which is absolutely fascinating, and it's such a great resource for our emergency department. So during your visit in the ER, you are undergoing various diagnostic studies. Those can range from just basic labs all the way up to a CT or a MRI or ultrasound, X-ray. So as the nurse, I'm kind of helping with those diagnostic studies. I'm getting labs on you. I'm sending those down. I'm facilitating your transport to CT, to ultrasound, to X-ray. And I'm looking over those results as well. Do I see anything that's out of the ordinary? Is there something that I need to notify the doctor about? Maybe they're thinking that one thing is going on with the patient, but there's also this other factor that's coming in. So a lot of it is just a constant reassessment, but paying attention to those results, and if there's something critical, letting the doctor know, and keeping an eye on the patient. Patients can change in the blink of an eye. So just ongoing assessments of those patients and keeping the doctor informed about what is going on. So based on that information that we gather from all those diagnostic studies, the patient is either discharged home, which is great, we want that, or they're admitted to the hospital, or even transferred to another hospital for higher level of care. That patient can be admitted to cardiopulmonary or med surg or ICU or to surgery or transferred out to a different facility. Maybe that patient has a brain bleed and needs to go to a hospital that provides more advanced neurological care than we do at my facility. So you're treating those patients and help facilitating that care and that either discharge or admittance to the hospital. And one thing that's really important and is such a great part of my job is education. I'm providing these patients a lot of education about why they're there, what they're, being discharged with, and things to look for. And, you were given this medication, so look out for this. Or if you start having these symptoms, come back to the ER. So a lot of education goes on within the ER, which is absolutely amazing, and it's one of my favorite parts of my job. Another thing that I wanted to talk to, and kind of in conclusion of all this, is nursing is hard, and it's nothing that comes easily is never, worth it. I mean, nursing was hard. It's a hard program to get into. It's a hard program to get through, but it's so amazing on the other side. But a big part of being a nurse is taking care of yourself. You give so much to your patients, but you also need to take care of yourself. Burnout is high, especially in the ER, ICU, especially after COVID. So taking care of yourself is just as important as taking care of your patients, if not more important. So as a nurse, having something that I can do that brings me joy, that helps helps me process things. I like to go kayaking. I like to spend time with my family. We like to hike. Not as much as I need to, but we do like to hike and go camping and just kind of getting outdoors. I am the cow lady. I have cows that I love, and I love just going out there and spending time with my animals. It's something that brings me joy. And so I suggest that to anybody that is going into nursing. Another thing that plays a huge part of my character, maybe, or just my life, is my faith. It has played such a huge role in being a EMT, paramedic, nurse. I remember I've had a patient I was transporting to a facility that was an hour and a half away, and I had a mom that was having a premature baby, and we were going code 3 lights and sirens. She was in active labor, and I remember praying, "Dear God, let me get to this hospital. Guide my hands in taking care of this baby if she were to deliver in the ambulance." And getting to that hospital and having that baby deliver when there was a team to take care of, it was a prayer answered for me. So there have been a number of times that I've prayed with patients. They're scared. It's scary being in the ER. It's scary knowing that you're going to surgery, or just the fear of the unknown. I have prayed with patients. I prayed for a patient that had just lost her husband and now was in the ER herself. I prayed with her. Some people don't want that, and that's fine, and not everybody feels comfortable doing that, and sometimes it's about getting out of that comfort zone, but it's something that's very important to me. So I just wanted to share that with you, but I encourage you to make this big step into nursing. It's a huge step, but it's a beautiful journey, and it is wonderful. You don't have to spend your entire career in one specialty or one area. There's so many doors that can be opened. So I just wish you the best of luck in your journey. If you are ever in clinicals or work in the hospital in Magic Valley and you happen to see me in the ER, please say hi. If I can answer any questions, I'd be more than happy to. So good luck on your journey. Welcome to nursing.